Good morning. It's 9:03 and I'd like to call the Health and Human Services Committee meeting to order. The first item on the agenda this morning is public comment. If you wish to speak, please come to the podium, state your name, and you have 3 minutes to speak to the board. Would anyone like to make a public comment? Would anyone like to make a public comment? Good morning.
Good morning. I'm Megan Ryan from Holland Township, District 4. I want to highlight something that Chair Rhodey said at the March 19th HHS meeting. Quote, "I don't think that we should discount those lived experiences of families," end quote. This was in context of possible vaccine injury, but since the lived experiences of those families should not be discounted, perhaps there are other people's lived experiences that should also be considered more fully. I don't think that you should discount the lived experiences of health department employees who are telling you they feel they have been grilled or targeted in some way. I don't think that you should discount the lived experiences of employees who are being asked to do multiple jobs because you won't release grant money to make a new hire. I don't think that you should discount the lived experiences of members of the Momentum Center and other social outlets for those with mental health conditions. I don't think that you should discount the lived experiences of CMH consumers who felt demeaned by language used by a member of the board that you had appointed. I don't think that you should discount the lived experiences of men struggling with mental health who might not be aware of resources to help because you rejected a grant. I don't think that you should discount the lived experiences of LGBTQ youth after you rejected a suicide prevention grant that linked to resources for them. I don't think that you should discount the lived experiences of community members who were able to receive the Mpox vaccine at a Pride event. I don't think that you should discount the lived experiences of the severely immunocompromised who found out exactly how little their neighbors and classmates cared about them when those neighbors refused to follow the best precautions available during the pandemic. None of these lived experiences are mine, and I recognize it is easy for all of us to stick with people who are like us and have similar lived experiences. But as elected officials, part of your job is to work to overcome this tendency and listen to and represent people with diverse lived experiences. I hope your acknowledgement that lived experiences matter carries over into future decisions. Thank you.
Thank you. Would anyone else like to speak? Okay, seeing none, we will move on to approval of the agenda. So next we have approval of the agenda. Is there a motion to approve the agenda?
So moved.
Support.
So it's been moved and supported to approve the agenda. Is there any discussion? Okay, seeing none, all in favor of approving the agenda, please say aye.
Aye.
All opposed, say nay. So the agenda is approved. So moving on to consent resolutions, we have one item under our consent resolutions, which is the approval of the proposed minutes from the March 19, 2024 Health and Human Services Committee meeting. Is there a motion to approve the consent resolutions?
So moved.
Support. Okay, it's been moved and seconded to approve the consent resolutions. Is there any discussion? Okay, all those in favor of approving the consent resolutions, please say aye.
Aye.
All opposed, say no. The consent item is approved. As we have no action items for this meeting, that moves us to our committee reports, where we will receive updates from several departments. So we will begin with Jennifer Brzezowski from the Community Action Agency.
Good morning. Jen Brzezowski from Ottawa County Community Action Agency, or OCA. I recently gave annual report, so I won't take up too much time with other programmatic details. So after our report, there was a comparison made about the assistance provided to the seniors in our food program, CSFP, versus Senior Project Fresh. And I also noticed it was on the agenda today, so I hope that I could talk through some of these details and provide a little bit more clarity. I know Commissioner Cosby, we were talking about meeting with Addie and Lisa, and it sounds like that meeting is not going to happen. So I just, again, want to provide some clarity about what our program is versus Senior Project Fresh. So Senior Project Fresh has been a wonderful complement to our program, CSFP. It's not meant to take the place of our program or the other way around. Because we're not able to provide fresh produce to our participants, Senior Project Fresh is something that our clients look forward to every year. Although it's only a $25 coupon, it's a lot more to our seniors. I know I talked about this in the annual report about them being able to get out into the community to pick out their own produce, interact with local growers, and receive valuable nutrition education. A few weeks ago, we actually met with Public Health's Planning and Promotions team to see if we could take on the project because it is really important to us and our seniors. And once we learned the greater detail about all the steps in the process, the amount of work that goes into the program, we determined that we were not able to take ownership of it ourselves. So I'm just hoping that there's a solution today. If not, it would be helpful just to know how we can respond to our clients that do reach out to us and they start calling us around this time of year. So that is all I have today, unless there are any questions.
Thank you. Do we have any questions?
Sure, just one. So it sounds like there's kind of some overlap there between the client bases. Is it the same client base or different?
I can't say for sure if there are some that are served with Senior Project Fresh that aren't served with our program, but I do know a lot of our program participants are served, do receive the Senior Project Fresh coupons.
Is
Or
it
did.
partially because of like where they live or they're in a certain community or
There
community
are
center?
some, yeah, there are some that are at senior sites that we also serve, but then there are also some that used to come through our drive-through locations as well.
Thanks.
Mhm.
Okay. Any other questions? All right, thank you.
Thanks.
All right, next up, we have Kendra Spanger from the Department of Health and Human Services.
Good morning.
Good morning.
All right, just a couple of brief updates. A couple of press releases came out since we met last. First, on March 25th, the press release came out on our Bridges Tracker, which is the website newmibridges.michigan.gov, or at michigan.gov. And that actually allows clients to check on the status of their application. So if you order food, for example, let's say at a pizza place, you can go on and see my order has been received, my food is being made, my order is being delivered. There's like do. The same thing will now be available for people to check the status of their application when they apply for assistance through the department. So another just easy access tool for our clients so that they're not having to call and see what's going on. They can go in and see it for themselves any time of the day. So very excited about some of that new technology. Also in the last month, we have hired our 3 staff for our family impact team, which is the connection between our assistance payments program and our child welfare system. So very excited to see some expansion there, working with some community partners on ensuring that resources are bridging gaps so that we're not seeing kids coming into our system for neglect reasons. If there's other ways that they can receive resources for their families to maintain intact. So very excited about this project and pilot, which we are phase 2 for the state. And again, just very excited about what that looks like. And hopefully I'll be able to provide some updates in the future about some specifics that we're assisting with. On the child welfare side, also a press release came out on April 12th. Related to gun locks. And so gun locks are available now at local county offices for those that may need them, either having children in the home and or other adults that may have disabilities and such where trigger locks may be helpful. I know those are also available at some of our law enforcement agencies as well, but they are also available now at our office. And then lastly, continues to be Child Abuse Prevention Month. So thank you again for allowing some of the county locations to have the blue pinwheels out. We did have our event last week, Thursday, and very thankful to SCAN and many agencies that had booths and participated in the event to continue to talk about awareness and initiatives that we have here in the county. Unfortunately, I won't be here in May, but in June, I will provide the follow-up data on our Medicaid redeterminations, as May will be our last month. So as of June, we should have some finalized numbers of the impact that we will see for individuals that will continue to be on Medicaid. And I'll provide some pre and post data from 2020 to 2024, so you can see that information. That's all I have. Unless you have any questions.
Do you have any questions?
Do you have, by chance, any of the child abuse stats for the county?
What specifically are you looking for?
So I'm wondering trends, you know, I understand under COVID, you know, and the lockdowns that we did see an increase in child abuse. As I recall, and I'm just wondering, are we trending downward?
It's actually the reverse. We're seeing the numbers go back up. So I can definitely bring some data in June to provide for you. Our numbers went down, actually during COVID. We have lots of, you know, anecdotal reasons for that, you know, people obviously not seeing kids, you know, those kind of things. So, but I can definitely bring some specifics for you. We track the data, and I know in the annual report that I submitted, in the PowerPoint did have the trend data for each year. But I can definitely bring some additional information on not only the numbers of investigations, but the number of calls have also gone back up. So I can bring all of that with me in June.
Thank you.
Yeah, you're welcome.
And was some of that due to kids not being in school? So schools often are the reporters, so there were less eyes on kids happening too, right?
Yeah, and I think at one point we broke down like our reporting sources too, so I can bring that specific information as well. We are also in the process of revamping our mandatory reporter training, and that should be coming out, I believe, this year, looking more at what can we be doing as a community to assist with cases that maybe don't fall in the line of child abuse and neglect, but needing resources and connections. They're also revamping the training to make sure that there's not racial and ethnic disparities in some of our calls, which they're seeing in certain communities, that a number of calls are increased based on race and ethnicity. So a lot of data is being shared to revamp that training. And so that will also, like I said, hopefully be coming out by the end of the year as an RFP went out, and they did select an agency to revamp the training. So I think we'll see some differences there too in getting that out to the community. We have some great agencies that provide the mandatory reporter training, both the CAC, Scan Council, and our office. So between the three of us, we really hit every school for sure, but then also other agencies as well that are required to have that. So we'll definitely, I think, see some changes with that as well, which will be helpful.
Okay. And then I just wanted to follow up a couple of questions on your family impact team.
Yeah.
Which I just always love prevention programs. So just curious, how many families are you serving, or are you ramping up right now? How many families are you anticipating?
So
be
the
able to help?
pilot started in August and we were phase 2. So we just hired the staff, 2 of which just started yesterday.
Okay.
So they haven't served necessarily anyone
Yep.
at the moment. Looking at what's happened so far statewide, our closest county that has the fit is Allegan County, Allegan-Berry. And so far statewide, it looks like they've been able to assist at least 500 families, which is really great numbers when you're looking at the number of families we're serving in general. So for us to have 3, we were ecstatic. Some of the things that we already talked about doing, or we've been doing anyway without those staff, would be some of the connections of things like daycare, making sure that families that are eligible for subsidies for daycare are getting those subsidies and finding good quality daycare. So we're not seeing kids over the summer maybe being left unattended. That could be somewhere else getting supervision. So those are some of the things that we're really going to be hitting, making sure that we're not getting new cases for CPS come in. And then also, how quickly can we get families returned home? Obviously in Ottawa, our number one thing we're working on is housing. You know, we can't have kids coming into care because of lack of housing, or, you know, we don't do removals because kids are in shelter. So really trying to find ways to continue to keep those families intact by meeting those social determinants of health.
have they seen an impact on the number of kids that come into care due to that being in place? Has that impacted that?
Yeah, I think that's, prevention is so hard because prevention is hard to put a number on, right? Like, I mean, you can say we put the service in there and we never saw them. And so I'm not sure if they've like quantified, like, because of this didn't happen.
Sure.
But we can definitely check with them on some of those specifics. I think there is a great database that we're going to be using to track some of that for ourselves and provide some reports just to say, this was provided, so this happened. Now, I don't know if those two systems are going to talk really well to say after 90 days, they didn't come back into care or they did go into care. So I think those are things locally we'll have to be tracking very closely. So.
Okay. All right. Any other questions? Mr. Ebel.
Thank you for the great presentation. I do have a couple questions that I was asked by constituents regarding the gun locks. And you probably have said this before, but I guess I wanted to know again. So they can go to any law enforcement agency, like they can go to the sheriff's department here and ask for some, and they can go to the Holland Police Department and ask for those gun locks besides going to your department. And they were also wondering, is there a fee? Can they get more than one? Can they get 3 or 4? So can you just maybe talk about that a little bit?
Yeah, I can't talk for the law enforcement agencies because I don't know what their capacity is. For us, yes, they can come in and make the request. And if we have the number that they're requesting, and indeed they have guns that are registered to them, then indeed we can provide those.
Okay, so then you look them up to see whether, or do they have to bring the proof that they're registered, or when you say?
At this point, I believe we're going to be taking their word. Like they should say, I have, 3 guns registered to me. We at our office do not have the capacity to look that up, but I believe law enforcement would have the capacity.
And do
to
you
look that up.
take their names and addresses or as
Yes.
well? Okay.
Yep.
Okay, thank you.
Good question.
Okay, any other questions? All right, thank you.
Thank you.
All right, next up, we have Jason Schenkel from the Department of Veterans Affairs. Good morning.
Good morning. Start off with a couple of special recognitions. Abby and Facilities have been doing great work, helping us look at space and picking her brain. She's got a lot of information about veterans in general, which I appreciate. Zach Clark in IT has been a rock star, helping me build out on base. Forward thinker, so he's really helping me look a couple of years in advance, which is appreciative. And then Taylor Carlin in HR has been fantastic and a great interview partner. So I just wanted to publicly say thanks to those 3 folks for helping me. So staffing, we actually shut the requisition down for our administrative assistant at 65 candidates. So it's awful refreshing to see that folks are really interested in our department and wanting to come and work with our team. So I think it speaks a lot about what we do and how we serve the community. Second round interviews this week. So Thursday, I should have a final decision on that candidate. Talk about on base. Phase 1 is complete, which was our veteran intake form or our profile. And then our medical transportation ride request. The contact form is amazing for the fact that it's going to really give us a lot of reportable information to help us make some really good educated decisions in the future. So I'm glad we're able to start tracking some of that information. The profile also gives us some contact info, telephone numbers and email addresses. So in the future, if we're looking at doing potentially a newsletter or really that trickle down information that comes from the feds and the state, it'll give us an opportunity to be able to push that information out to our veteran community. So I'm glad we're able to start building on that database. The ride request is also trackable and it has a built-in workflow process. So it makes us really efficient at getting our rides requested. It also gives us the ability for the future, if we decide that transportation services needs to look a little differently, or it's an internal program, we'll have the ability to build that out. Phase 2, which is our outreach profile, which will be a database of our community partners, point of contacts, and a communication log. It's really going to be built for continuity. So if there's any change in personnel, we won't lose any of that data and our partnerships and things that we're doing within the community. So I think it's important that we have that continuity and we don't lose those relationships. A burial allowance is part of phase 2, and then our county veterans emergent funding application. The state went to the Michigan Veterans Trust Fund, one electronic. So we're going to kind of mirror what they're doing to keep consistency. So our emergent funding application will also be electronic as well. However, we're not taking the human element out of it. We'll still have to do our interviews. And then we will also be able to complete applications for folks who can't complete them on their own or who may not have the technology or the ability to do that. A couple of community events coming up. The 16th, we're working with Community Health. They do the Community Health Fair. So we're going to partner with CMH. The 17th is kind of unique. The VA hospital out of Battle Creek is working with the state, and they're doing what's called coffee with campers through all the state parks throughout the state. So on the 17th, we'll be out at the Holland State Park doing coffee with campers to see if we can't talk to individuals about the VA. And then we have our Michigan Veterans Affairs Leadership Summit will be in Detroit on May 1st. Some second quarter numbers. Veteran Service Officer appointments. We had 52 available days. We conducted 212 VSO appointments for claims for both veterans and surviving spouses. Medical transportation, we had 27 veterans with 87 rides, 3 approved and 1 denied. Burial allowance, 1 recommended Michigan Veterans Trust Fund case. And then our Ottawa County Department of Veteran Affairs funding, we had 5 cases with an emergent spend of $6,668.90. Questions?
Any questions?
Where are you in the selection process for your administrative assistant?
Round 2 on Thursday. I should have a decision Thursday afternoon and make an offer.
How
Yeah.
many candidates did you?
4.
Okay. 4
Yeah,
from the
and we
65.
give the second round is an assignment. They have to actually do a presentation on an event. So one of the big events that we do annually we're in August is going to be a homeless veteran stand down day and resource fair. So I asked them to plan the next one, which would be tentatively, let's say Allendale area. So they would have to plan the event, find a venue, talk about who's going to attend, look at the budget, that sort of thing. So it's going to spark some creativity in how they present it. I didn't really give them too many specifics on how I wanted it to come to me, but so we'll see how creative they are with their presentation and how far they've really drilled down into the event. And then it'll give us a really good look at who's next. So.
Is it
yeah.
an event you hope to
Mhm.
eventually launch?
Yep,
Excellent.
exactly. Yeah.
Awesome.
So it'll be a real life exercise.
Thank you.
Nice.
One quick question. I know there's some requirements around some of the treasury or trust fund grants that go out. In the past, I think they were kind of tracked on paper, maybe. Is part of the improvements that you're making related to the tracking of some of those and how often they go out? And if I know sometimes veterans might come in multiple times for the same thing where they have to be spaced out.
Correct.
Does that make sense?
It does. So the answer to that at the Michigan Veterans Trust Fund, which is the state emergent program, they went fully electronic and it has a tracking mechanism within it. So you can see if a candidate based upon social security number has had previous.
Oh, great.
Right. So, and then you can see you can look at the application and what the claim was for. So you can look at redundancies to see if they're, returning customers or not.
Right.
This is also unique for the fact that before it was a set it and forget it. So once the county submitted it to the state, we didn't really get to see where it was within its process. Now it actually sends out status updates. We get decision letters come by email to the case owner, which in this case would have been me. And then the applicant also gets a decision letter. So then you kind of understand where it's at in the process. Or if there's corrections, we can go back in and edit the case. This last one I just did, the state wanted me to tweak it a little bit. So our emergent funding from the county, which comes from our general fund, we're going to mirror that process so that we will have the reportability. Right now I'm tracking, obviously, because I have to report it to fiscal and we have to pay folks, but this will give us the ability to identify the applications will be uploaded into OnBase. We'll have historical data. And then what we talked about with the veteran profile, pretty much anything that goes into OnBase is reportable. So we'll be able to see a lot of that information. But I'm glad the state did what they did because, I mean, we're still responsible for that application and that committee. Both the state funding and our county fund has a oversight committee who approves that funding. So it just gives us the ability to be able to track data, plus electronic signatures. We don't always have to be sitting around a table to get things done. We can work remotely as well if we need to.
Thank you. That's exactly what I was looking for. Thanks.
Yep.
I appreciate the data on the kinds of services you've provided. That's really good to hear, like how active your department is and exactly what you're doing. So I appreciate that report.
Okay, thank you.
Any other questions? No? All right, thank you.
Thank you.
Okay, next up, we have community mental health and Katie Flossing.
Good morning.
Good morning.
Thanks for having me. Haven't been here before, so appreciate the opportunity. I have two updates from Community Mental Health. The first is about our Children's Mobile Crisis program. Children's Mobile Crisis provides on-call workers that have the ability to respond to crisis situations that are occurring. We operate Monday through Friday from 5 p.m. until 12 a.m. Open to any child in Ottawa County ages birth to right before their 21st birthday, so through 20. Staffed with a mental health clinician and then also a support person that goes along as well. They have the ability to provide phone consultation or can respond in person to the home. That's determined by conversation with the family of really what they're looking for. Before the staff leave or end the phone call, they provide safety planning and then issue any referrals as needed from that conversation. Some data, we started this program in September, and in September through December, we were just open to internal CMH consumers. And then we launched publicly January 1st. So since we've started, we've had 37 total calls. We've been dispatched to the home 14 times, provided 17 phone crisis consultations. 6 were non-crisis situations. So maybe calling for information or something else that was determined not a legitimate crisis. And we've serviced a total of 24 unique kids in the community. We're really trying to promote Children's Mobile Crisis. And so we have staff and the ability to present to schools, present to organizations, present to anywhere we can get the word out. So I have some flyers that I'll leave with Jordan after this, just if you guys are aware of organizations that would be interested in hearing more. We would like to get that word out. We've tried to launch this program before and it hasn't been successful because we just didn't have the volume. But we truly believe that this need is in the community. So when people just aren't aware of what it is. So I wish we had 35 applicants, but staffing is an issue, or 65 applicants, staffing is an issue for mental health clinicians. And so as we go into the summer, it's a hard role to fill, being on call, just especially at night. So that's a concern that we have right now. We're getting by, but always looking to add to that panel of on-call workers. So I will leave the materials here for you guys. Second update is Michigan's update. The CAFAS and the PACFAS are two assessments that have been used for a long time in order to determine level of care and also the supports needed for children ages 0 to 18 in Ottawa County for services. We're transitioning over to the Michigans. It's the first time I can recall an assessment being changed. The Michigan stands for Michigan Child and Adolescent Needs and Strengths Tool. My understanding is that Michigan's is going to be more narrative based as opposed to just scoring mechanism. It will be used to support family-driven youth-guided care and planning. Michigans will be used at point of intake. So if a child is coming in to receive services from CMH, it will be used at that moment. And then it will also be used every year going on to measure outcomes and to see if we're making hopefully growth. It's required for infants, toddlers, children, youth, and young adults through the age of 20. And it also is used on all populations in which children's services cover. So our autism, also intellectual developmental disabilities and serious emotional disturbance. CAFAS and PECFAS before were only used for serious emotional disturbance. So it's a tool that can be used across the board. We're currently working with the state to get it embedded in our electronic health record. That's a big task. We meet weekly to work through that. And then the state announced that Ottawa County will be in the training cohort that starts August and September. So it's kind of hoping we'd be in one that was a couple months before, but we will get running up to speed. So that is all I have.
Okay, thank you. Are there any questions?
Question.
Yeah.
And it's related to forgive me here, the Children's Mobile Crisis.
Yes.
Call it Center, Mobile. I was wondering, Helen DeVos, have you dropped literature off at Helen DeVos? We probably have a strong collaboration. I know we used to send most of our children to.
We do.
DeVos.
I'll double check with the person who oversees it just to make sure that she has, but we have pretty much stuck our heads out in any place that will take us. So, but I'll double check.
They have as a triage nurse.
Absolutely. And it's great
care
planning
manager.
when someone's discharging from
Exactly.
inpatient to say, this is the service that's there. And most other counties are also providing this service. So, but it's just getting the word out that it's available.
Thank you.
Yeah.
And I love that you've opened it up so that it's beyond just EMH clients now. So that's so helpful because I agree. I think it's very needed.
Awesome.
So I haven't seen, but have you guys put out any information on Facebook? Are there Facebook posts?
We
and stuff
have,
like that?
yep,
Okay.
we have, we put it on Facebook. It's on our website as well. And I also just had some initial conversations about maybe trying to get it in the county newsletter
Okay.
as well.
Okay. That would be great. All right. Any other questions? All right. Thank you.
Thanks.
Thank you.
All right. Next up, we have Adeline Hambley with the Department of Public Health.
Morning.
Good morning.
First, you may have seen in the news there, we have a dairy farm that has highly pathogenic avian influenza. So one of 4 counties total that have found that. We're not the lead agency on cases like this. It's MDARD has a whole section of like zoonotic veterinarians that work on this. So MDARD is working on the farm animal health. I heard there was a team from USDA that was in Michigan on Friday, trying to do some trace back. We are helping to monitor employee health. It's not as much of a risk to human health. People can get conjunctivitis, things like that. So we're kind of monitoring that because they want to make sure that cows aren't usually a great reservoir for the mutating it into something worse. So, and cows, unlike poultry, usually recover. So at this point, the milk supply is safe due to pasteurization. We'll continue to work with MDARD and USDA to monitor that and provide updates if that changes. A couple of items that I believe will show up in front of the Finance Committee that I wanted to touch on. There's a grant from Lara for a marijuana operation and oversight grant. It's almost $40,000. It's specific to for working with school resource officers and law enforcement, and purchasing and providing vape and THC detection equipment that they've requested that they thought would be helpful to have in the schools. So the bulk of that grant, I think there's a little bit, maybe $1,000 or something for mileage to deliver those that equipment, but the bulk of it is to purchase equipment for the school resource officers. So I believe that will be on or should probably be floating out there for the Finance Committee for next week. The other item I touched base with John, I know he's working on this, and you've seen it a couple of times, is the environmental health position for an administrative assistant. Just to clarify, when I was talking to John a bit, the funding for that was, he thought maybe it would be helpful to talk about that a little bit more. So the funding for that is essential local public health services. And there was a $25 million increase from the state for those services, those mandated services. However, we weren't awarded that until after. We tried to estimate because we knew there would be some increase, but didn't know the exact amount. But that had to be a budget adjustment after the budgets were approved. And so that money was approved and accepted by the board. This is us trying to expend those funds. Specifically, the food safety is an ELPHS program, as is water, wastewater, so drinking water and wastewater. And those two programs received a significant increase. I want to say it was over $500,000 to those two ELPHS programs. And I know if you have questions specifically about the program, Spencer's here too, so he can talk or about the position, about what their duties were. So, but that's the funding background. On another related note, I was hoping that there could be some confirmation for board approved policies that are in place. I think I brought up last time the deauthorization policy, that's a Board of Commissioners approved policy in place. And then when I had brought that up to reactivate positions, previously Deputy Administrator Wetmore had said that there were a few commissioners that wanted to hold and not and revisit that policy. However, I think that the board itself approved a policy on policies or it had a title, something like that earlier this year. And so I guess I'm needing some sort of confirmation. It's my understanding that board approved policy is a board approved policy that's in effect until it's not. What that policy is for is allowing us to hold position and not fund it. So it gets deactivated if we don't have funding going into the budget. However, if there is funding that we can work with HR and fiscal, so HR confirms with fiscal that funding is available and we can reactivate it. And the point of that, their background is so that you're not having departments just refill immediately and automatically so that we don't lose positions, whether they make a determination if they need them or not. So we had two positions that we were looking to reactivate. These are funded specifically through ELPHS funding. the STD funding is an ELPHS program. That fund, they received, oh, I can't remember. I know I just sent this to you yesterday, John. I can't remember if it was like 100,000, I think, went to that line for ELPHS. And also Title 10 funding. So Title 10 received about $200,000 increase for Title 10 services. And so those were both, again, issued after the budget was approved. So those positions were on hold until we knew we had funds. Funding was approved, accepted by the board. This is us trying to expend them. Again, I know we talked about this during budgets, but some of those funds are Title 10 funds. If we're not expending them and providing the services we're required to expend, there's always a risk of not being a Title 10 provider. As a little bit of just framing, excuse me. Previously, our clinical services that provided STD and family planning, we had 2 nurse practitioners, 5 RNs, and 2 medical techs. And right now, because our nurse practitioners, we just had someone leave, we have 0 nurse practitioners, 2 RNs, and 2 medical assistants. And so right now, that's all they're operating on. So our medical director is stepping in to act as a provider, as is one of our supervisors that has a master's in nurse practitioner. So
I'm sorry, Eddie, can you just back up and
Yep.
say those numbers one more time? Like what you used to have and what you have now?
yeah, so we used to have 2 nurse practitioners that acted as the providers for providing, prescribing, 5 RNs, and 2 medical techs.
Okay.
Now currently we're operating with 0 nurse practitioners. We do have one of those positions posted. The other position is the one we're asking to reactivate. And they're both 0.6s. They're not 1.0s. And then 2 RNs is what we have right now. And then a few years ago, we changed medical techs to medical assistants because they have a little bit more breadth in the scope of work. So we have 2 medical assistants instead of techs in the program. Let me see. And then I wanted to touch base on the discussion items on there. I touched base with John on this because again, there's 2 specific public health programs under discussion items, and I haven't received any discussion questions or a request for information on those items. I wanted to touch base on the real estate. I know that there was a brief or a meeting with some realtors, Spencer Ballard, the environmental health manager. And so I guess I'm not exactly sure. I have Spencer and Drew here as well, if there's questions specific. I would say it's been like we talked about last time. It's been a while since we revisited the service provided and reporting. But I would argue that there's importance in that program, and that it's not just protecting public health, but it's protecting buyers so that they're not having unexpected cost of $10,000 or $20,000 system after they purchase a home. So I think continuing a work group to work through, if possible, even having some home buyers or sellers on there. So we're getting the user perspective, not just realtors that are involved in the transaction. But if there's specific questions, I asked them to be here too, since I wasn't sure what information you were looking for. Hold on. For Senior Project Fresh, so right now you can pick up those at 2 locations in the community, which is Evergreen Commons in Holland and 4 Points in Grand Haven. Historically, we fulfill the function for those unable to go and pick up those vouchers. And usually we're going into like senior living or senior apartment complexes. So it should note that nutrition and health education is a key public health function under the law. And so that's where it's fitting into our powers and duties. So we coordinate, I know Jen mentioned it with OCA. So we do coordinate when there are other events that might have people that qualify for the service and try and get them these vouchers as well. In the past, we've provided nutrition education services and also try to connect people to other services in the community they might qualify for. I'm not sure, again, if there's specific questions, I can try and answer or get the information and get them back to you too. So that is everything I have. Does anybody have any questions?
Any questions?
No, just point of clarification. So the policy you're discussing earlier about being able to deactivate and activate positions,
Mhm.
is that policy unique to the health department?
No, that's a county policy.
Countywide
Yeah.
policy? And so in the past, we've had this policy enacted and then we no longer do. Do you know why that's happened?
In the past, so how the policy is written and in the past, we have funding. So like in this instance, we got increased funding after the budget. Once it goes through the board approval process and those funds are accepted, then we go through with, or any department would go through HR and request for hiring approval for this position. And so that position isn't new, it's reactivating it because it exists, it's just wasn't funded. And then they confirm with fiscal services, is there funding here for this? Is there money to pay for this? And then a fiscal services will usually, yep, there's money available. Yes, it's not term limited, or yes, this is only a 1-year thing, so that HR can put on there that this is, sunsets, whatever date. And then the position gets posted and we fill it. When I put that request in to fill these positions, I got that the HR and fiscal would like the administrator to okay that activation. And so it was falling kind of right in between when there was like a transition. So it initially went to John, and I think that was the week or right before he left. And then it went to Ben. And then the response I got back from Ben was that he heard from some commissioners and that they would like to hold on it. And so it makes it confusing to figure out how we're supposed to do our work or processes when it's unclear when a policy that's an active board policy is going to be followed or not. And so I brought it to John, but I mean, that was probably like a week ago. So, I mean, he's kind of getting a lot coming at him at the moment. So, but they're not new positions in the same way that environmental health administrator or administrative 2 position is, and that it's never existed before. It has to go through like committee and the board and be considered to be approved. And so these other positions have a what HR calls a position number attached to them, but in the system, yeah, they're not activated because they were previously pulled from the budget because of we didn't have funding.
So it's the difference between a new position and one that's been previously approved by the board.
Yes.
Is there a time limit to that? Do you know?
Um.
In the policy?
Oh.
I'm just thinking operational.
I don't believe there is. There has to be I didn't bring a copy of the policy in front of me. It's on the internal website under the policies. You'll see it. I don't believe there is, but there needs to be, in order for those to be on hold, a request has to have been made by the department. So for these, we had made that request last year when we were doing budgets because we weren't sure where we were falling with state funding. So we wanted to, and they did not at the time have people in them. So we said that we were backing them out, but we would like to maintain them so that if we do get funding, we can reactivate them. The other position that we did that with is the clinic manager, because right now the clinic manager is still vacant. But it's not a cost in our budget because we asked for it to be deactivated until we have enough funding. We're doing some assessment to figure out like what exactly we need there. In the past, it was more of an office administrator, clinic manager, but we would like to move it more into like a medical background, like an MP or RN, somebody that can help do the clinic services. So that involves kind of reevaluating what that looks like. So that's another position that exists, has a position number tied to it, but isn't active. If that makes sense. Okay.
Commissioner Zylstra.
Yeah, just to answer Commissioner Cosley's question, I'm just reading here. The department will be allowed to keep the position vacant and retain the ability to fill it in the future. So there's
Yeah.
no end date, it just says in the future, so.
Well, and I appreciate that you brought it to John Anderson, and that's certainly the appropriate avenue when you have a administrative question like that. So thank you for bringing it to our attention, and we will talk with John more about it and take a look at it at policy and planning if necessary. So.
Okay.
All right, any other questions? No, all right, thank you.
Thanks.
Okay, our next item is, we have two discussion items, and the first one is real estate inspection, environmental health regulations update from John Anderson.
Thank you, Madam Chair. As Director Hambley had mentioned, we did discuss a little bit. The first one, as far as the real estate inspection, this concerns the point of sale of inspections of septic and or well systems. And there had been some discussion previously. It was mostly brought up through real estate agents regarding the timeliness of the inspections, and that kind of brought it to attention to look at other aspects of it. Specifically what other counties do. There is some discussion at the state level about mandating these inspections on a regular basis as opposed to just the point of sale. So there's a lot of different aspects floating around out there. And unfortunately, about the best update I can give you is it's in these discussions are in the most preliminary of areas right now. We are just beginning some of it and talking with environmental health. Hopefully, as these move forward, we can provide a little more detailed information for you about which direction the county has, at least the options they have to move forward with that one. In relations to the Senior Project Fresh program, the update wasn't really specifically for me about that, as Director Hambley had discussed, and it was more about the voucher distribution. At the time, I wasn't sure if we even had to still pick those up. I wasn't sure the burden that was on public health, since we're still trying to get through some of their position requests to get those in front of the board. It was more of if the administration or other departments can assist with some of that, just to make sure we're not letting that program fall by the wayside. And we can still do that. But as far as the project itself goes, that was really all it was about today was just trying to make sure we have something in place. We heard from the Community Action Agency as well as the Public Health Department, and we'll certainly work with anyone to try to make sure those are handled if need be. Since it was brought up as far as the deauthorization policy, and I do appreciate with Director Hambley's patience with this. This is almost as clear as mud a little bit as far as the deauthorization and reauthorization policy. I've talked with both fiscal services and HR, and there's no real clear answer on it. It almost sounds like we're going through the process of a new FTE request because even though the position is still there, we've talked about the funding. I have made a commitment. We're working on it and trying to see what we can work through whether or not this needs to go through a regular process of a new FTE request, or is it just simply in this position, check the box and we, excuse me, move forward on it. So hopefully we get that resolved here very soon. Right now we have, since I landed here roughly 5 weeks ago, I've had 7 new FTE requests across all departments. So trying to vet for those and make sure we get them processed accordingly so we can get them to the appropriate committees and then the Board of Commissioners.
Thank you. Are there any questions?
Administrator Anderson, can you tell me, was the midterm or mid-budget year FTE request a common practice? I think you and I have kind of had some discussions about this.
We did, and a lot of that started with my previous experience in a county where it was almost you had to move heaven and earth. It was kind of unheard of off budget year or off budget cycle FTE or new position requests. I spoke with the director of human resources, and she said at some point that never used to happen. It was always very extremely uncommon unless it was very urgent circumstances. So again, that's not to say we can't at least look at them, but it was just a little foreign concept to me.
Thank
Okay.
you.
Commissioner Zylstra.
Thank you. John, just gonna give us an update. I know you talked about the time of sale work group and that being very preliminary. How does that affect the status, or what is the status of that EH personnel request?
That's the
I know it's kind of-
administrative, right?
Right, it's kind of sitting here as an action item. We're heading with that one. I mean, for me, they don't really overlap. I know that for some commissioners they do, but just what is the status in the personnel request itself?
I think we're ready to start pushing that forward. For me, one of the biggest ones was just making sure, working with fiscal and with the departments, that the funding source was there. And that was pretty clear. It was the continuation of funding and making sure that whether it's a year or two or more down the road, that's not going to fall back onto the general fund. The best I can come up with, or that we've between the health department and fiscal services, is that is something that should be a continuing funding source every year, every fiscal year.
Okay.
And we're talking to the director of human resources for positions like that. There's also they typically tell the client, the applicant, that this could eventually sunset and that therefore the position may not be available somewhere down the road. So as long as we have that, I think we're ready to move forward on that.
Great, thanks, John.
Okay.
Okay, any other questions? All right,
Thank
thank
you.
you. And now is our second opportunity for public comment. So if you would like to make a comment, feel free to come forward, and you have 3 minutes. Good morning.
Morning, my name is Dave Barnowski and I vote in Port Sheldon Township. I just have 2 items I'd like to bring to the attention of the board. One I've already mentioned to Commissioner Cosby, and it's just a technicality. There's been no legal notice posted about the cancellation of the Talent and Recruitment Committee. There's supposed to be a legal notice that goes through the Justin Roebuck's the board is supposed to be posted where the notice is. I couldn't find it. It's not there. It's just not been done. There's a second thing that you might not be. I don't read Simply American every day, and so maybe you don't read a Holland Sentinel every day. And so there's a letter to the editor today that I wanted to bring to your attention. The letter to the editor is by a well driller from Coopersville, who says he's operated his business in Ottawa County for 59 years. He's been able to talk to numerous well drillers, septic installers, health inspectors, and real estate agents, all in and out of Ottawa County. I'm not going to read all of his letter, but I'll just grab some highlights. The general consensus is that this is work that should not be done by outside vendors. Let's see, highlight. He's worked with at least 10 different health departments. Ottawa County Environmental Health is one of the best. Yes, I have in disagreements with my inspectors and county officials from time to time. Their job is largely a thankless one. Nobody is usually happy with the news they receive in the reports. But from his perspective as a well driller, their job as inspectors is critical to protecting our precious resource of groundwater and ensuring that our homeowners have safe systems. And in the end, he wants to make sure that if you do go forward, that you bring in all of these stakeholders to discuss it, but he does not want you to change the system as it is. Thank you.
Thank you. Would anyone else like to speak? Good morning.
Good morning, Karen Obitz. I live in Spring Lake Village. I had to exit to receive a phone call, so I wasn't able to hear all of Administrator Anderson's reports. So I regret that because I was hoping to be able to speak to something that I anticipated he would talk about there. So these might be a little truncated comments. My apologies. What I heard today, and I always appreciate the reports from the department heads, was from the Community Action Center. Some comment, and again, I apologize, it's really hard to hear back there. I don't catch everything people say, but I think what she said was something about she would really appreciate having, as a staff person, clarity regarding the status of the Ottawa Food Coordinator and the Senior Project Fresh program in particular, because of the way in which she also interacts with that segment of the population. So when I listen to the department heads, I'm listening for not just the services as described, but also staffing needs so that they can help deliver those services. So those kind of are where my thoughts go when I'm listening. So with that in mind, I also noted that during Director Hambley's report for the OCDPH, she referenced those policies and how that's having some impact right now in ways I wasn't quite able to follow, but something to do with maybe changes in administrative positions. So things get caught in between position moves and people leaving and coming and going. So again, what I'm hearing is that these deactivated positions really need to have some attention in a concerted manner so they can move forward with those. And I did note some of the questions that were asked by the commissioners regarding that situation. The question I didn't hear was, what impact has there been on the services that maybe are not being provided as those now funded but not yet reactivated positions are addressed in a timely manner? So again, those would have been my questions and concerns, and they remain mine. Thank you.
Would anyone else like to speak?
Lori Grassman, Robinson Township. Being we're talking Senior Project Fresh, I just feel like as a taxpayer, if my money is going to be spent on spending for a coordinator, I do feel like we have to look at outcomes, like Gretchen has always said. And I think that the outcomes get very manipulated by these evaluations, because I went through Senior Project Fresh 2023 evaluations, and what I have found is that number one, of the 345 people that received the $25 vouchers, only 317 took the pre-survey, whereas only about 162 took the post-survey. So when they do percentages at the end to make them look like they're flourishing, it's not necessarily a flourishing situation because they use percentages of instead of numbers. And so I guess I just wanted to highlight a few things that first, one of the number one reasons that people did not use all their vouchers were ride issues, yet they aren't provided rides through Ottawa Foods for Senior Project Fresh. So if that's the number one issue, I think that maybe we could possibly look at mailing the vouchers, possibly, because they did also request that a reminder, they would like a postcard. So it seems like the seniors are very, very willing to get mail for these things. So that would be beneficial, possibly, rather than going up and above and having to pay for a coordinator. I also want to highlight that Senior Project Fresh through Ottawa Foods is only 55% of the vouchers redemptions since 2017. So really the other two locations are really holding their weight. And so I think that there could be another avenue looked at. Since 2017, 35,000 has been redeemed, which is great. But there's also been 25 29% of the vouchers that have not been redeemed since 2017, which totals almost $15,000. So we're failing a little bit in the voucher redemption situation, considering it's only 5,000 redeemed. And they claim that this is the highest number that they've ever got redeemed, yet it's also the highest number that they've ever not used. So that's a little confusing. And it's also below average. I don't know if we pay $120,000 for below average. I think that maybe we could look at that also. I also want to quick highlight that as the numbers produce, there are 78% of people that don't actually see like benefits. There's either no change or their health gets worse. So I do think that we have to deep dive into these things because these evaluations don't actually show truth. Thanks.
Thank you. Would anyone else like to speak? All right, seeing none, as adjournment is at the call of the chair, I call this meeting adjourned. Thank you.